Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hey listeners, I value you being here. Please, I encourage you to leave a review. I'm going to be reading out a review each month, and that person can have a one-on-one call with me to have a chat. And I think that is a great way to reward you as a listener. Also, as you like and subscribe to this podcast, it helps get our message out to other physicians and clinicians who are struggling. Thank you so much for your reviews, and I look forward to reading them out here on the podcast. Hello, everybody, and welcome back. Today we have Tracey O'Connell with us. I'm excited to hear about all the things that she's up to. I will let you introduce yourself. Welcome.
Hi, Sarah. So good to see you. Thank you for having me on your podcast. I've been a fan for a long time and always admired your work from a distance. So it's nice to spend some time with you. I was trained as a radiologist and I left a toxic private practice job where I was for about 16 years. I left there 8 years ago. And I still do teleradiology an hour or two a day from home, but primarily I'm focused more on work around vulnerability, shame resilience, especially these topics around physicians. Some work with teens and some work with the LGBTQ community. I also am a facilitator of expressive writing, and so I like to use that tool. It's almost a gateway to opening people up to the idea of vulnerability. Brene Brown says you can't be vulnerable by yourself. You have to be vulnerable with other people. But I do think there's a stepping stone, which is to be vulnerable with yourself. And sometimes we have so many walls around us that we can't hear our own perspectives or opinions or even know ourselves or trust ourselves. So the expressive writing work can be a great way to respond to prompts and have a one-on-one conversation with yourself.
Fascinating. Yeah, I'm very eager to hear more. All right, tell us why radiology, your journey to that place.
Well, I went to medical school to become a psychiatrist. And as sometimes happens, I had a very strange 6-week rotation in psychiatry. I was very young and I was the age that my 3 children are now, in my early 20s, and I didn't have a very easy experience. I saw the extremes of the mental health spectrum. I had kind of imagined myself working with normal people who were having a hard time, and this was much more than that. People that were institutionalized or imprisoned or on long-term antipsychotics, a lot of, or even in an emergency setting where someone would come in crisis and then be given a diagnosis in 5 minutes that didn't seem like enough time to really fairly assess the patient. So I felt very concerned at that point, since that was why I had come to medical school and it was the end of my 3rd year. And in a nutshell, there are 3 radiologists in my family: my father, his brother, and his brother's wife, and they all knew that I wanted to be able to have a family and balance work and home. And so they said, oh, you should go into radiology because you'll really be able to separate your home and work life, which was true. And also, because I'm a pretty highly sensitive person, it was true for me that it was good for me to distance myself some from patient suffering, but working in a room in the dark by myself for 9-10 hours a day was actually pretty detrimental to my well-being and mental health. And so I did it for a long time, thinking it was my attitude or that there was something wrong with me, and was always seeking my own therapy and psychiatric help during those years. And one thing led to another, and there was a big change in the practice, and I realized things were not going to be getting better. And so that was the opportunity for me to step away.
Fascinating. Okay, tell me about that 6-week rotation in psychiatry. Had you seen what you wanted previously modeled to you, which was, well, people having a bad time? Had you had that experience anywhere?
Well, it's funny. Growing up, my parents divorced when I was 4, and
Mhm.
I was an only child. So my father decided to go to medical school at age 28. So I vaguely remember him going in medical school and residency and medical training. And we had a lot of doctor friends. And also my mother remarried, and my stepfather was a cardiologist and had a lot of doctor friends. And I think just by default, I was, again, a very sensitive kid. And because I had to travel back and forth between my parents, long distances on airplanes, I made friends with a lot of strangers. And I really loved hearing people's stories. People were really kind to me as a little kid traveling by myself. And also, and I was pretty fearless. I guess I was comfortable talking with people. And then I would often get off the plane and, be so excited about this new friend I met and introduce them to whatever parent was picking me up, and just really fell in love with, really felt safe and comfortable talking to anyone. So when I got older and even younger, just kind of always befriended the friend who was sad, or the friend who was needing something or going through a hard time. And not many of my friends' parents were divorced at that time. So I felt I was very emotional and had a lot of things to process, and maybe not a lot of people to talk to about it. So it made me more keenly aware of a need for that.
Mhm.
So I was just kind of innately drawn toward wanting to help people who were having a hard time feel better. And if you can remember, maybe you can remember life before the internet, your notion of what you could do with your life was more limited. It was, in my case, I kind of didn't want to be a doctor. I wanted to do something else. And I majored in psychology and actually got my worst grades in college in psychology. But at the time, to pursue psychology, which would have been a great role for to be a therapist, it just didn't seem to be what I was seeing. I was seeing a lot of research, experimental psych done on rats, and a lot of work that just didn't seem human related. And I didn't have access to the potential things you could do beyond that. And I'm allergic
Mhm.
to rats, so I couldn't do the rat research. So I think that then that was kind of my understanding. And so I'm sure a parent or family friend said, well, you should go into psychiatry, because then you could do what you thought you would be doing, counseling
Mhm.
people during their hard times and helping them feel better. And so that was my
Mhm.
intention in pursuing medicine.
Mhm. Got it. Yeah. I remember as a third year student doing a psych rotation in a forensics department, and it is not the psychiatry you were looking for. I understand that long or short discussions with very unwell people who have not um, been living a standard life for a long time is a totally different experience at 20 when looking to talk to well people having a bad time. Yeah, yeah. I can see how that was very confusing.
Right. And I even thought, even if this is just the training part, like I had some sense that this isn't everyone who sees a psychiatrist. I knew
Mhm.
there were people that were having jobs and lives and seeing a psychiatrist, but I wasn't even convinced that I could withstand the time
Mhm.
of of training. I felt
Mhm.
it seemed, we didn't use the word trauma at that time, but in retrospect, it was traumatic
Mm.
to see what I saw, and not then, and ironically, not be asked to process it by the instructors, not saying, what was that like for you? How are you holding up? Was that upsetting for you? What's coming up for you around what you just saw and how that person was feeling and doing it? So I stopped
Mhm.
sleeping, and I got very anxious myself, and ended up really believing there was something wrong with me, just like people do, right? When you, in medicine, you acquire every syndrome you read about or whatever. It wasn't that I developed the symptoms of the people that I was witnessing as patients, but it was more my own feeling of like, what's real? Who am I? What can I handle? This is too overwhelming. So
Mhm.
what am I even doing in medical school, right?
Yeah, yeah. You're right. I don't know that I was even asked the same question. How was that for you? What are you thinking about that? Have you got a way of processing that? Yeah. We don't do that very well in medicine yet for each other, still.
Mm-mm.
Mm-mm. Okay. So then you transitioned to radiology and you described this workplace that you were in for a long time as toxic. So can you help us navigate what, other than being in a dark room for many hours, what else about that position was not good for you?
Well, again, back in the day when I was in training, I will say I did not have any malignant experiences as a resident. I feel grateful that I had good instructors. I think though it was difficult because it was in a busy hospital, and the expectation was that residents were workers and needed to learn radiology outside of work.
Hmm.
And also, like most disciplines, you only know as much as you've been exposed to. So we would rotate through different disciplines like chest or abdomen or neuro and or ER or ultrasound. And you would only know, or pediatrics, you would only know barium work, you would only know what came in that day. And
Hmm.
you might have time to discuss it with the attending. Mammography as well. There's a lot of areas, but nuclear medicine, I'm just thinking out loud. And it was hard to learn or be prepared because you might go home and read about nuclear medicine, but then the next day you might not ever see the thing that you read about. So that was intellectually challenging, but I think I found that part very interesting. And I love art, and I found the challenge of looking for the anomaly in the pattern
Hmm.
recognition. I think that was actually something I am good at. So it was more, then it became more about the experience of the types of people I was interacting with. When I first went into radiology, that was back where we used to hang the films. And we also were an integral part of patient care. So in a hospital, the teams would come down from the infectious disease floor or the bone marrow transplant floor, and they would come to the radiology department as a big group. And some people would get nervous, but I enjoyed that. I felt like I was part of the team, and they were coming down, and we would scroll through the panels to find the patient they were concerned about, and then they would share what was going on with the patient, and then I would explain what was going on with their imaging, and then we'd kind of brainstorm and put those ideas together. Very shortly after I finished residency, everything switched to computers. So PACS was a system that's now global, which is how teleradiology can even happen. But once
Hmm.
that technology switch happened, teams stopped coming down because they could just have a computer on their floor and they
Hmm.
could read the report. Also, we used to talk into a tape, and a transcriptionist would type what we said,
Hmm.
and
Hmm.
we would review the reports and tell the transcriptionist to make the change. Very shortly after, like, all these changes happened at once, where we were dictating into a voice
Hmm.
recognition system, and then we were responsible for making sure that the voice recognition system didn't make an error. And at the beginning, they made a lot of errors. So it's very time consuming. And all of this also coincided with technological advances in imaging. So
Hmm.
things like CT existed before an MRI, but they became faster,
Hmm.
much, much faster. So fast that the images and studies could be generated much quicker than anyone could keep up with the time
Hmm.
for interpretation. And then the demand became higher because people are waiting, the ER is waiting for that exam.
Hmm.
You know what it's like. So it became what had originally, what I had intended for this to be, a consultant job where I would be a person talking to other people about sick people. It
Hmm.
became a person in the dark talking to a machine and not knowing anything about what happened outside of that vacuum. And
Hmm.
honestly, there are a lot of people in radiology who like that, who didn't want patient contact, and this works out great for them. I was somewhere in the middle, in the sense of I was intimidated by and very compassionate toward people who were sick. And for my own well-being, some part of me recognized, ooh, this is going to take a toll on me.
Hmm.
And so I should separate myself from that kind of emotional weight so that I can have relationships outside of work and sustain my well-being. But so many things shifted, and my colleagues were not people that I was able to establish a lot of rapport with. So that kind of led to just a lot of isolation.
Yeah. Yeah. And good things don't happen to you in isolation.
No, again, for some people they do. But I will just say for me, it did not.
Mm. Yeah. Yeah. All right. So tell us about writing, because this became a big prominent part of your life. Had it been there prior to you noticing the suffering that you're having within your work day?
No, no, not at all. No, I'd never had been a writer at all. I mean, I used to keep I don't even know that you would call it a diary. I used to keep sort of a daily, it wasn't a journal either. What would you call it? Almost a daily, what's it called? Like a daily minder, or
Hmm.
that you just write down what you're going to do each day,
Oh yeah, yeah.
sort of just to keep track of your schedule. Or,
Hmm.
but I would do it after the fact. Like it started, someone gave me for a holiday gift or birthday something, one of these daily planner. That's what it was, a
Hmm.
daily planner. And so I would, as part of a nighttime ritual, just jot down my day,
Hmm.
things I did, thinking, oh, I'll want to remember this day. Like, but
Hmm.
it wasn't a gratitude journal. It wasn't a personal journal or a reflection or a feelings journal, a place to like say what I'm really thinking and feeling. It was very, very boring. In fact, my
Hmm.
college roommates would make fun of me because they'd see it on the counter or something, and I would always start with, just because it was a pattern, again, a pattern to go by. It would be sort of like, got up, ate like what I ate for breakfast, went to this class, very just kind of going through the day in a very rote, boring, factual way. I might say I had lunch with so and so, but I didn't write about what we talked about or anything
Hmm.
like that. And then, yeah, in school and in lower school or in college, anytime I had to write a paper, I was very uncomfortable with that. Didn't feel like that was a strong suit at all. I wasn't a reader, which is really strange because I'm a huge reader now. But
Hmm.
as a kid, I was not a reader, and I did, believe it or not, I got through high school and college without really reading. I would just show up to class and take meticulous notes and memorize them
Hmm.
and do well. And
Hmm.
it was getting to medical school that really was it was a shock because there was so much reading and I really didn't know how to read. It sounds strange to say, but so I didn't bring, there was a time where I kept more of a journal or a diary when I was in my 30s, that was at the suggestion of a therapist. And when I read through that journal as I approached 40, I was very disturbed by how my inner dialogue had not changed at all, that I was still writing about the same fears, anxieties, worries, annoyances, frustrations, problems. And 10 years had gone by and I had been in therapy that whole time. And
Hmm.
it was horrifying because I thought I have not grown or changed or evolved at all.
Hmm.
Uh, I have a friend who said, yeah, but you were building your career and having babies and doing all these other things. But I'm just saying, from a adult development standpoint, I had not developed nearly as much as I felt would have been logical, given how much time and energy I was investing into ways that my life didn't seem to be working, and being in therapy and feeling like I'm trying and trying and trying to make me feel better about what from the outside looks like an amazing life.
Hmm. And this is still as a radiologist, is that right?
Yes.
Yes. Okay. All right. So you've got 10 years of documented inner reflection of you doing therapy, going to work, and you're like, 10 years has gone past and it's same thing.
Yes.
And what were you missing out on? So what was it that as you looked at that reflection of 10 years and you're like, nothing's changed, what have you missed out on? What is medicine costing you? What has that, what was that in that you gained from doing that exercise?
Yeah, I think again, I felt a really strong sense of I need to do something different, because I'd been
Hmm.
looking outside of myself for salvation. And I also had always been, for as long as I think I started reading for pleasure when I was in medical school, because I had met my husband right before medical school and he's not in medicine, but he always read a book before bed. And so I started doing that. And I was always then reading things to kind of try to connect to humanity, try to connect to either, it wasn't even so much fiction, a lot of self-help, ways to
Hmm.
sort of change my perspective on things. And I think when that epiphany happened, when I saw in my own writing that I hadn't really evolved. I just felt there was some deep sense of I need to do something really different. This is not going to happen from the outside. It's going to be, I remember thinking I have to do the opposite of what I normally do because my default settings or habitual ways of coping with day-to-day life are not changing my lived experience. I'm surviving, but I'm
Mm-hmm.
not thriving. And coaching didn't exist then. I
Mm-hmm.
was just truly, I also, my best friend had died, and my psychiatrist closed her practice, and my kids were diagnosed with celiac disease, and me too. And I suddenly just everything I knew as one way was just not that way. And it was a huge upheaval and also like such a great thing, of course, through the retrospectoscope, because it forced my hand to doing a lot of things differently.
Mm. Yeah. Yeah, that's a lot. They're big, big items, big ticket items happening there. In amongst
Answer,
it, in a reflection of this isn't working for me. I'm not having the experience I want to have in my day to day if I keep doing it the same way.
right. And
Mhm.
you had originally asked me about writing. Writing didn't actually come into my life until I left that private practice job 8 years ago. So I was not doing any writing un until then. Then when I left that job, I was waiting to be credentialed to do teleradiology, which actually was taking 6 months. So at first I was very agitated, like I've got to get onto this job. I've got to start teleradiology. I can't pause. But then I couldn't rush that process. It was out of my hands in these different states. And so I heard of this integrative health coach training that was happening here at Duke University. I went and did that, and it was really wonderful to just meet and look at the world from a different perspective. There were no other overtly medical people in there. There were a couple of, I think there was one woman who was a nurse, but it was a really refreshing way to look at life and health and wellness. And it also was not feeling like that's what I want to do now. Uh, but right after I finished that course, there was a course being offered called Transform Your Health, Right to Heal. And again, I'm waiting for the credentials to come in. And the course is offered at night. It's once a week for 2 hours. So I thought that sounds like that could be useful. I would like to know what you mean by transform your health, right to
Mhm.
heal. And the instructor was this guy, John Evans, who people have heard of, James Pennebaker, who is considered the father of a grandfather of expressive writing. He would say that writing has been a tool for as long as people could hold an implement for expressing and drawing and self-expression. And he's at UT Austin and did a lot. James Pennebaker, a lot of research, is still alive and still noting how expressive writing your most honest thoughts and feelings without punctuation or grammar, anywhere from 3 minutes to 20 minutes to longer, without writing it for anyone else to read, uh,
Mhm.
about the hardest thing, that's about the most significant emotional experience you've had, and how the Pennebaker paradigm was to do that right for 20 minutes every day for 4 days in a row about the same significant emotional experience, and see how that evolved for the person doing it. And this was also, the course included all different types of writing, like mindful writing, compassion writing, legacy writing, um, affirmative writing, transactional writing. And so it was wonderful. And I really love the instructor. We didn't share what we wrote about. It wasn't an expository thing. No one
Mhm.
was putting this in a publication or a journal, or even sharing. It was not, it was a very private experience. We were in
Mhm.
the room together responding to the prompt.
Mhm.
And then we would do what's called a post-writing reflection, where there was a couple of survey questions, like, to what degree were you completely honest, from 1 to 10? To what degree did you express your deepest thoughts and feelings? To what degree do you feel happy now? To what degree do you feel sad?
Mm-hmm.
Was this a meaningful experience for you? And then a reflection on what came up for you. So we would potentially share those. We would say like, wow, this surprised me, or this was hard for me, or some things came out of this I never knew. But we didn't share with each other what we had
Mm-hmm.
divulged in the writing. And I really loved that. It was very, very helpful for me.
Coming out of a workplace that you had described as toxic and in a place where you were managing grief and change, that sounds like it would have been a very interesting and possibly rewarding experience to do.
Yes, because we also would sometimes write from another's point of view.
Mm.
So it helped me, like we might write from the perspective of a fly on the wall or someone else who was present. And for me, when I left my private practice job, it was, when I say it was toxic, it was an accumulation of a lot of, I was the only female in my division. I was much more expressive than many of my cohort. Like, and I also worked part-time. I didn't work full-time. I was not a partner. So there were many ways that I was othered. And
Mhm.
even though I'm proud of myself when I look back for advocating for myself and not betraying my values, I did that for my family and for what was most important to me, but it made me very unpopular and it made me feel ashamed of myself for not being able to do things just like everybody else did. I didn't feel a sense of pride in that at the time. I
Mhm.
felt inept, and also because I had gotten so depressed after doing those rotations that didn't work out, I thought of myself as fragile. And so I can't work full time because I won't sleep and I won't be able to function. And there's something
Mhm.
wrong with me, as opposed to, um, actually, this is really hard for most people. And I'm actually sustaining my well being by
Mhm.
not biting off more than I can chew or not promising things that will be impossible to deliver, but I'll keep trying. So I was
Mhm.
honest with myself. I feel very good that I came out intact, but it was with a lot of baggage and shame around I can't cut it like everybody else can.
I'm hearing that a lot from so many sources right now that the volume is massive. The additional work list that came out of COVID is had have added at least another 50% of the workload. That we're being asked to see more and more with less and less time. And the the shame, like you described, the shame of I can't do it like the others can. What's wrong with me that I can't keep up? What's wrong with me that I've got leftovers that I have to do on the evenings or weekends? And when we start to have these conversations, we recognize, oh, I'm not the only one. I'm not the only one who can't keep up this pace, who doesn't like this pace, who didn't sign up for this, who doesn't want to do it this way. It's not sustainable. And so I like this conversation, Tracy. It's like I chose to do it differently. It made me the other, and I internalized the shame about that. But wait a minute, it was intentional because I needed to be sustainable. I needed to also be mom in my life, and I didn't want to give it 120% at work and, or 200% at work. I wanted some left for the rest of my life. But you've come out of that with this internalized shame about it. That's such a common experience for people in medicine. It's very important that they hear this.
Yeah, and also back in the era that I was experiencing this, there wasn't that language around it.
Mm,
Like even the therapists and psychiatrists that I was going to help me carry on and keep showing up, not missing ever. I never missed a day of work, and thankfully I've never been sued. But mentally, I was not present. I was not okay. And I thought that there was something wrong with me. And also, in psychiatry, they'll give you a diagnosis so that you can get covered by insurance. So adjustment disorder, generalized anxiety disorder, major depressive disorder. Um, and when you internalize that you have a disorder, then what I realize now, but didn't at the time, was that you pathologize normal human experience. So I walked around for decades believing that I was mentally ill,
Mm-hmm.
even though I feel so much for my younger self, and I'm so grateful for the language that we have now to for you to even know what I'm talking about, for it not to be the sense of bravado or armor around us that's so thick that people say, well, you're really telling me a lot. It's making me uncomfortable. I don't know. I would trust you to be my doctor either because you're really you're describing a lot of feelings here that make me doubt your ability to do good work. Um, and because I was so honest, it was a lot, it was a lot for my coworkers who were just very much like money driven and productivity driven. And that could sustain them, but that couldn't sustain me.
Mm-hmm. I think that we do see seasons of careers, and so money driven, being able to see high volume, being able to keep up with the pay, work for a lot of people for an amount of time in their career. But then they start, as they hit their walls of being able to keep this pace, then they very much have the same experience of, not all of them, obviously. Everybody's unique here. But so many say, why can't I do this anymore? What's wrong with me now? I could do this before, but something's broken. There's something wrong with me. It's like, no, that pace wasn't sustainable with your physiology, with your humanness. If you're going to sit in a room for 12 hours, your body's going to start to disintegrate. There's going to be consequences on you if you don't pause and kind of consider you too.
Well, and even I mean, anyone listening, it's not, I was sitting a lot of the time or doing procedures, but I mean, just anybody in any career where you're on that hamster wheel, it is not sustainable. And I think in the past, people would attribute, most of the time, people would just wait until they got sick to pause, and to have a physical ailment the only sort of get out of jail free card to dismiss you, because even a death in the family would be, the expectation would be that you would be back the next day. Um, or even if you were sick, can you just come in and work anyway?
Mm-hmm.
Can you get an
Mm-hmm.
IV pole? Can you put a
Mm.
commode by your computer? I mean, so that was a little gross, but I'm surprised that didn't happen. So anyway, I feel like I don't feel like anything is wasted, because I feel, and I sense from the way you're responding that you're resonating with this phenomenon. It's not new that it's not sustainable. I do think that there was an era when my father and my stepfather and these family members were practicing that is now referred to as the heyday of medicine, when technology was advancing. It was very interesting, but it
Mm-hmm.
wasn't overwhelming. And the
Mm-hmm.
expectations were still that things could be done the next day or next week or next month. There was not the ability to rapidly generate reports or see, there were office hours, the office is open, the office is closed.
Mm-hmm.
The whole healthcare system was different. And so I think there's a million reasons we could say that people can legitimately say now that burnout is obvious and that all of that is not sustainable. But I do think that what I like to bring to the conversation, the kind of conversations you and I are having, is that this isn't about the individual doing everything better. This is about recognizing your own. I think that's why the writing was so helpful for me, because I didn't have conversations with myself except that were berating, denigrating, internalized external messages of
Mm.
expectations. They weren't compassionate
Mm.
voices. They weren't tender, and they weren't necessarily even my own thoughts. Most of what I was doing was things I'd memorized to do, or the way I was taught to feel, the way that
Mhm.
I was modeled as a child, the way that women are modeled to be. There were
Mhm.
so many institutions that we all talk about now very much more openly than we did. But this idea of vulnerability is really the way I was made. It's in my DNA. And I know a lot of people in medicine, if they ever were vulnerable, have had that trained out of them. And I think the veneer that we put on that everything is fine, it's a real catch-22, because I know people don't want to have their doctor come in and say, oh, I'm really losing it today, or this is too much for me. Let me talk about me. There has to be some, I guess, if I were to postulate a solution, it would be there needs to be more people working for less money and working less so they can have a life that they really love and they're not working all the time and they have interests outside of work. And perhaps if there's perhaps artificial intelligence will take over that element of who gets to be the genius, who gets to be the hero for making the diagnosis. Maybe that will be relinquished to a machine or a protocol or an algorithm. And then the best doctors will be the ones who can really be present and help discern what this means and explain it to the patient and be with them at the bedside with their families like they used to when we only had maybe one antibiotic or didn't even, and could be accept that this is all we can do.
Mm, interesting. So interesting. Can you tell me about Brene Brown? You said you do some of her work in the world as well. Tell me about that experience for you.
So I mentioned that I was always reading self-help, and when Brene Brown's book Daring Greatly came out, I had grabbed it at the bookstore on the way on a family trip. And when I was reading that, it was the first time I'd heard shame
Mm-hmm.
mentioned and defined and described in ways that weren't like you've murdered someone and now you feel bad about it.
Mm-hmm.
Uh, it was much more ordinary, and it was the scenarios with the description even of feeling like you don't belong, feeling I'm bad, I'm not enough, or I'm too
Mm-hmm.
much.
Mm-hmm.
That language, it was huge for me because I didn't feel that I fit. I felt there was a reason why I was feeling anxious. There was a reason why I was feeling sad or overwhelmed. But being able to get that word and that vocabulary and even talk about vulnerability, it was massive for me because I didn't have the language prior to that felt like this is exactly what I'm struggling with. And so I always would read through her books voraciously, and I think those really helped me. I was probably close to 45 when those came out, and it's funny because I'm around the same age as Brene, so I always felt when she came out with a new book, I'd be like, damn it, I wish I had written this down, because it would always be sort of describing the way that I was feeling, even though I don't have her background or research and as a licensed clinical social worker, but it felt so validating. And so when I left that job and I was waiting and not knowing what was next for me, I reread Rising Strong, which was a book about if you are vulnerable and you put yourself out there, inevitably you're going to fall. It's not all going to work out just because you were brave. And then what
Mm-hmm.
do you do to get back up again? And so when I first read it, I read it cover to cover quickly because I just wanted to be well versed in it. But then when I left that job, I was really in a fall down moment. And that I finished the book, and in the back of the book, there was a little blurb about if you would like to work with or get in touch with someone who's a certified Daring Way facilitator, go to this website.
Mm-hmm.
So I ran to my computer and looked it up and found that there was someone in my community that was a certified Daring Way facilitator who was actually a licensed clinical social worker. And I looked her up on the internet and saw that she was offering a class called Rising Strong for Women
Mm-hmm.
in like 3 weeks. So that felt divine. And then in that group, what was really amazing was it was what I presumed to be similar to like AA or Narcotics Anonymous or any Al-Anon or any kind of group situation where we were all from different backgrounds. There
Mm-hmm.
were no other doctors there. There were women who were going through a divorce. There were women who were having a partner with a substance abuse problem. There was someone who was just there because they were curious. There was someone who was there because she didn't know how to tell her parents she wasn't going to graduate school. There was just a mix of real life, and we were in that situation, and we were going through this work and workbook together, talking about what's the story you're telling yourself of what has happened to you. Is that story true? And what are the things where is the story coming from? Is it coming from your parents? Is it coming from a teacher? Is it coming from a partner? And it was such an amazing experience. And after it was so healing for me. And then afterwards, I signed up to be on, they were full, the trainings were full, but eventually there was an opening. And so I went through a year-long training process to be certified to lead those kind of groups or one-on-one activity. And, I think I thought at that time, oh, that'll be my golden ticket, because this is so amazing and everyone's going to be jumping all over this when they learn the the philosophy and the methodology. But it's funny because people still don't flock toward that. There's a lot of resistance to that. I think for those listening who don't know about Brene Brown, she's now written, I don't know, 6 or 7 books. I think she's coming out with a new one this fall. I don't know what it's about. And has 2 podcasts and really revolutionized that, like I said, that language around shame and what is shame resilience. How do we bounce back when we just can't say it's not just grit and pull yourself up by your bootstraps, when it's really that internal dialogue of what you're telling yourself about what happened, and maybe learning a new language to deal with emotions. And it's interesting because everyone loves that work. If you're seeing it if you're listening on a podcast or reading about it or watching her TV special, but then they turn that off and they're like, whoa, I can't do that. So for years I thought, oh, well, I'll be the Brene Brown of medicine. And I still might, as part of me might aspire to that. And I also I don't think at this time in my life I have the life energy or I want the accountability for that. It would be a huge responsibility. And also through groups of people that have done this work that are also in medicine, we've met with a lot of resistance. There's a lot of resistance because people think talking about those types of things is unprofessional or uncomfortable, or my colleagues don't need to know that. So I think Brene probably herself knows that, because she's married to a pediatrician, and despite her venturing into the military and Silicon Valley and NASA and all sorts of big arenas, she has yet to freely enter the medical life, because I think it's really unique. Because supposedly shame is never useful for motivating or helping anyone, but it's used all the time. Shame and humiliation are used all the time in medical training and medical practice. And so I get that there's a lot of resistance, but I do believe that it's the path toward sustainability.
Well, I think the written expression that you were describing earlier, where you're not even really sharing the story, but you're doing that internal looking at it and from different perspectives. And then that experience you were talking about in the small group is that almost trauma-informed lens of what happened to you and who noticed, and what meaning are you making of that, and what are you doing on the back end of that experience. It's a very healing way to manage big things that have happened, or even that lived experience of the constant, that whole decade you said of the same, nothing's going well, coming out of that going, what? Like it's almost like you fell into it, but what a great thing to have happened to help you coming out of such a difficult time.
Well, and actually it felt like jubilation. It felt like something I wanted to celebrate, because suddenly it changed my whole narrative about myself and
Mhm.
about the way I was feeling. And
Yeah.
it, rather than pathologizing, it normalized and actually made me feel kind of amazing, or kind of really alive and really psychologically safe within myself. I think
Mm-hmm.
there's such a lack of psychological safety in medical life and
Mm-hmm.
in medical settings. We try to
Mm-hmm.
provide it for the patients.
Mm-hmm.
It's not always there. And
Mm-hmm.
the hospital administration is not as concerned about that. But as practitioners, I know very few people who feel psychologically safe at work. And that because we often cannot control the environments around us, to develop a sense of psychological safety inside oneself that says no matter what happens or what they say out there, that that sense of I'm okay, is just magnanimous and
Mm-hmm.
is life changing, truly.
Mm-hmm.
Um,
Yeah.
so I feel lucky to have had all of
Mm-hmm.
it.
Absolutely. Yeah. Where do people find you if they're looking to do some of this work?
Well, I have a website,
Mm-hmm.
which is my name, TraceyO'ConnellMD.com. I am on social media, but I'm really trying hard not to be
Mm-hmm.
because it's not good for my
Mm-hmm. Sure.
psychological space. It's not good for sustaining my well-being. And so I worked hard to reckon with that because I think when you switch and you're doing something new, you have to let the universe know that's what you're doing. And it's hard because I really believe in the work that I'm doing and believe in the power of it helping people, but I also just don't have the stomach for advertising or
Mm-hmm.
self-promotion. But over the years, I've done a lot of work that is still on
Mm-hmm.
YouTube, and Instagram and LinkedIn and
Mm-hmm.
Facebook. Um, and it's always my name, except for Instagram, my handle is Fertile Soul
Mm-hmm.
and not my name.
Fair
Um,
enough.
so yeah, but I think the best way, if anyone wanted to work with me, would be to go to my website and there's a link to reach out to me and have a chat and see if, the work I kind of have the website partitioned into whether you want to do coaching or whether you want to do the writing.
Mm-hmm.
And I've done a lot of writing workshops, so I offer those periodically. Um, and those can be done in group settings, but again, whether it's group or one-on-one, the writing is to the self. So it's not this thing where I don't want to share my stuff with everybody else in the room. It ends up
Mm-hmm.
being, again, just a very fortifying experience. And I think psychologically safe to,
Mm-hmm.
and if people get too deep and they don't like that, then they can pull back. They're in control.
Mm-hmm. Yeah, love it. All right. Anything we didn't talk about that you wanted to talk about before we end?
Oh, well, I wish we could talk about you. I would really love to know more, and so we'll have to do that. But I have just really, really enjoyed speaking with you, and I felt so listened to and cared about in this conversation, and that's rare.
Mm. Oh no, this is
So thank you.
excellent. I think those of us listening, we are in the pursuit of finding sustainable for us, whatever that looks like in your journey, wherever you are in your journey. And I think hearing this transitioning through and things that helped you is always so valuable. So thank you very much for sharing and for being vulnerable and for expressing all the things that you went through. It's really helpful. So thank you again, Tracey. All right.
Well, it's my pleasure. It's actually, it's much easier for me to be that way than to be some other way.
Very good. Well, you have a great week, everybody, and thanks again.
Thank you.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.